Hello, and thank you for watching. Strong Teeth for Life is a YouTube channel, and it's made by me, a British qualified dentist of 20 years, to help you have healthy teeth and gums. It's a free and open source, it's non-profit, non-commercial. This video series is about getting good gum care at the dentist. So, how do you know if you have gum disease? Well, your dentist carries out tests for gum disease. So, this second video is on tests for gum disease. Test for gum disease is using X-ray radiographs. In our last video, we looked at the gum disease process. When your dentist tests for gum disease with radiographs, they are looking at the bone levels and your bone health. So, if we look at healthy gums and we look at the bone underneath, like so, and we take a X-ray, then what the X-ray does is it's showing you a picture of your bone levels around your teeth. So if you look at the teeth over here, they're in your jawbone, and the bone levels are around the necks of the teeth. Great. So when the dentist takes an X-ray, it's showing the same thing over here. When you've got healthy gums and bones, then that's your teeth, and that around it is your bone level. Healthy gums have strong bone, shown by the radiograph. Now, when you have stage 1 of gum disease, where the gum skin is red and bleeding, but the bone underneath is healthy, then when the dentist takes the X-rays, which shows the section of your teeth over here, again, you're going to see normal bone levels. Stage 1 of gum disease has bleeding gums, but strong bone underneath, shown by the radiographs. So when you have stage 2 of gum disease, where you have the gum skin being red and bleeding, and also you have some bone loss, and you have, if it progresses, severe bone loss, then again, when they take X-rays, they're looking for the insides of your teeth. Now, what they're going to find when they take the X-rays is if you've had some bone loss, then that's what the X-rays are going to show. It's not right to the neck of the teeth there, the bone levels, they just had some loss over there. So if you go to severe bone loss, then what you'll find is that the bone levels are just here. Instead of being at the neck of the teeth, the bone level is going to be down here near the ends of the roots. And as you can see, that's when these teeth become loose and they start falling out. And that's what it's showing you, where the bone levels are here near the ends of the roots as opposed to near the crowns or the neck of the teeth over here. So stage 2 of gum disease has bone loss. That is shown by the radiographs with some bone loss. And this can progress to severe bone loss as shown by the radiographs. The dentist uses a BPE probe in your mouth to test the gums. This is the probe, and what the dentist does is, if we have an example of some gums over here, the dentist, they just run the probe, the BPE probe, around your gums, like so. And based on that, they can find out your gum health. With healthy gums, what you have is you have healthy pink gums which do not bleed, and also underneath you have strong bone. Now, if you look at this from the cross section of the teeth, then when the dentist is running the probe around your teeth, A, the gum skin is pink and healthy, and B, the bone is solid. So this would be a BPE score of 0, where you have healthy gum skin and strong bone. So healthy gums have a BPE score of 0. Then you have stage 1 of gum disease, where you have red bleeding gum skin, but you have solid bone underneath. So when the dentist runs the probe around your gums, what they will find is the bone is still strong, but the gum skin is bleeding when they're checking your gums. So this will give you a BPE score of 1. So stage 1 of gum disease has a BPE score of 1. Now, when you go from stage 1 of gum disease, of bleeding gum skin, but strong bone, to stage 2 of bone loss, that's where you have bleeding gums and gum skin. And what you also have is you have the bone being destroyed. So what will happen when the dentist is checking your gums is, when they check, they'll notice a dip when they're checking your gums over here, because there's been some bone loss. So over here you have bleeding gum skin and some bone loss here, and that's a BPE gum score of 3. So what will happen is, when they're checking your gums, if you had solid bone over here, that's fine. But what will happen here, when you've got some bone loss, the probe dips down, and that's showing us that there's been bone loss. which you can tell from the cross-section over here. Then if you get more bone loss, so you've gone from some bone loss over here and you've gone to a huge amount of bone loss over there. So what the dentist finds is that the gum skin is bleeding and there's been huge bone loss. So this will get a BPE gum score of 4. And when the dentist is doing this in your mouth, what they'll find is instead of having nice strong bone over here as you're probing, what they'll find is when they probe, they get a big dip. And the reason they get that dip is because as they're probing, that bone loss shows the probe just sinking in where the bone's been destroyed. So stage 2 of gum disease is gum skin bleeding with some bone loss being a BPE of 3. Stage 2 of gum disease with gum bleeding and huge amounts of bone loss is a BPE gum score of 4. So stage 2 of gum disease with some bone loss has a BPE score of 3, and severe bone loss has a BPE score of 4. Understanding the test results for gum disease is discussed in the next video. For oral health policymakers and dental educators, an idea is to use and teach the public to use a BPE probe in their own mouth. The 3D printed models that follow can be used to educate the public. The idea is to train the public, and as well as using the previous section on the BPE test video, the idea is to use these further models to train them. So this example here would be healthy gums with pink gum skin which doesn't bleed and strong bone. And the idea would be you just show the public that if they were checking the gums when they're probing around, the BPE probe is solid, it's not sinking. So this shows good gum skin, good bone. The next stage would be to train the public to show when you've got stage 1 of gum disease where the gum skin is bleeding but the bone is solid, which we call gingivitis. And so the public could see when they're probing around this model, the bone is solid, the gum skins are red and bleeding. And then the public could be trained on the second stage of gum disease where you've got bone loss, so they've got red gum skins which are bleeding. And this example over here, the bone is strong, but over here you've got some bone loss. So the public could see when they probe around teeth, they could find out, okay, there's been some bone loss here. So this would be a BPE of 3. And then they could look around this one over here and there's been a big drop here, which indicates a lot of bone loss. And this would be a BPE of 4. And this is what the models show. Here it shows some bone loss, and here it shows a lot of bone loss. So the idea is the public can use a BPE probe in their own mouths every 3 months after a dentist has seen the patient for safety reasons. For example, no relevant medical conditions. The BPE probe self-use gives the patient empowerment to tackle oral hygiene in specific sites in their mouth. BPE self-use is an alternative in countries with few dentists per population as a method of remote teledentistry. For the public watching this video, this is not advised to use a BPE probe in your own mouth because this has not been approved by the dental regulators. It is just an idea. I want to raise awareness on oral health, so feel free to download and share this video. Download the STL files for the 3D models in the description box. There is no copyright for personal use. For oral health educators, there are some free resources I found, some from this channel and also from other places and other tools.